Hi, everyone. Thank you for joining us from wherever you are joining from all over the globe. And it's so fantastic to see so many friends and long-term colleagues, peers, practitioners, and so on this webinar. Thanks for joining us today. Um, so the agriculture this is being hosted by by IFPRI and the ANH Academy. And the ANH Academy, as you all probably know, stands for the Agriculture, Nutrition and Health Academy Science Policy Platform now, which was called IMANA before. And it's a global evidence-based platform accelerating actions towards equitable and just food systems for nutrition and health while confronting climate change and protecting nature. Since 2015, the NH Academy has been catalyzing interdisciplinary research, fostering capability sharing and collaboration. The network now comprises of 12,000 members, from over 160 countries, a truly global community of interdisciplinary researchers, practitioners, and policymakers, such as yourself, working on agriculture food systems to improve nutrition and health worldwide. Through its original program, IMANA, Innovative Methods and Metrics for Agriculture Nutrition Actions, which was funded by UK Aid and the Gates Foundation, the NH Academy has forged new concepts and critical methods on food environment to help us better understand how people interact with food systems and what this means for their diets and health. This critical work on new concepts, methods, and tools has been driven as much by IMANA grants and fellowships, as well as through the ANH Academy Food Environment Working Group. Some of the research that our IMANA grantees and fellowships have forwarded, some of them you'll hear, many of you are here today, and one you will specifically hear about now, is including how households interact with external food environments, spatially explicit approaches to food shed level planning, analysis of sustainability and climate vulnerability of food environments, and more. Please do visit our website to know more about these grants, and also, of course, introduce yourself in the chat and try and get as much information as you want about these grants. The wider ANH community, again, has also been critical in co-shaping this big agenda through actively learning from and generously sharing with one another in ANH Academy conferences, learning labs, through the working groups, and of course, in many platforms outside of the ANH Academy as well. Today's webinar will showcase how tools and metrics can drive policy action, as we have already seen through previous IMANA projects, such as the uptake of NOVA UPF screener into Senegal's dietary guidelines. We will now turn to new and exciting food environment tools, one of which was developed through the IMANA investments, and which themselves are a testament to just how much this field has expanded and matured. In this interactive seminar, participants will also gain an overview of the Food Environment Toolbox and the Urban Food Environments and Diets UFED tool, which I'm learning about more for the first time today. We'll learn about how these innovative resources can help fill critical data gaps, integrate food environments and dietary indicators, and support evidence-based decision making. This will be followed by a panel of experts who will discuss tool adoption, data gaps, and policy relevance, and a short Q&A period. So I'm now delighted to welcome you to this event and to introduce the following presenters: Shauna Downs, who is an associate professor at Rutgers School of Public Health. Amy Morgalius is a research fellow at IFPRI, International Food Policy Research Institute, and Quinn Marshall, who is also a research fellow at IFPRI. And our panel is chaired by Shauna Downs, and the panel members are Amos Lar, Giacomo Zanello, Vinnie Bell, Suparna Ghosh, Jerath. Thank you all for participating in this webinar today, and all the panelists and the speakers today to also agree to come and present and share their experiences. Thank you.
Thank you so much, Sunita. Welcome, everyone. Thank you so much. I'm going to start by talking a little bit about the food environment and why it's important to measure it. And then I'll talk about the food environment toolbox. So in terms of defining food environments, we know there are many definitions of the food environment, but essentially it's the space in the food system where consumers directly procure food. So this is from Chris Turner's framework, and you sort of see the consumer in the middle of the food system. So you have the food supply chain that's leading up to what you find in the food environment and what's available, affordable, and acceptable. And then the way that the individual factors of someone that leads to how they interact with that environment, which then leads to their consumption patterns and then diet and nutrition and health outcomes. In terms of food environments, there are different types of food environments. I know in high income countries, we often focus on formal built environments, but obviously in low and middle income country context, there are many different types of food environments that people are accessing their food from. And so I'm just putting this up just to make you all aware in case you aren't, just because some of the tools that are included in the food environment toolbox do cut across these different food environment types. So why is it important to measure food environment? So first of all, poor quality diets are among the top contributors to the global burden of disease. So we need to do something about that. And we need interventions and programs that are really tailored to people's lived experiences so that they can have more of an impact in terms of improving diet quality and reducing the burden of malnutrition. In terms of food environments, they're very much driving this dietary and nutrition transition that you see in many countries. You have upstream drivers of the food system, such as trade policies, that then influence what you see in the markets that you're interacting with. And so it's really important to better understand the dimensions of food environments that are influencing food choice so that we can better design interventions and programs. So in terms of measuring food environments in low and middle income countries, there's a few things to consider. And I will say that the food environment toolbox that I'll be talking about is very much designed to be able to measure food environments in these contexts. In those contexts, you need to be able to measure wild cultivated and built environments because those tend to be the environments that people are accessing. But there's some difficulty a lot of the time in terms of capturing the dynamism of food environments in low and middle income countries. So for example, you might have, I've worked a bit in Cambodia, and sometimes you'll have markets that start at midnight and by 7 a.m. they're already gone. And so you need to understand those environments before you start to measure them so that you're not completely missing a really important market when you're doing your food environment assessments. And then lastly, you need to capture a range of different food environment dimensions. So not just the availability or affordability of food, but you want to also be looking at what kind of promotions or marketing they're being exposed to, as well as other dimensions. So in terms of the food environment measurement landscape, there is a lot of work being done in this space, and I'm not going to go into all of it. I'll talk about the toolbox, and then Quinn and Amy will talk about UFED. But I did want to just point out that a lot of these tools or assessments, they're not necessarily duplicative, but they're often very complementary. So if I think of, for example, Informis, which Amos was involved in Ghana, it's quite complementary. So there's tools that, for example, aren't in the food environment toolbox, like online tools to assess food environments, and assessments for supermarkets that might be more relevant for certain contexts. So I think it's important to just acknowledge that there is a lot of tools out there, but I do think that there's a lot of complementarity as well. Okay, so I will talk now very briefly about the food environment toolbox. This was a grant that was, or this project was funded by the Mana Grants Program, as Sunita mentioned, and it took place over about 2.5 years, although I think a lot of time before the actual beginning of the grant, a lot of time and energy went into the thinking around the toolbox because it was really much grounded, or very much grounded in a lot of the work that myself and my colleagues have been doing over several years, trying to measure the food environments, but not necessarily doing it in a systematic way. We have a really large research team that were really instrumental in getting the toolbox completed, and my colleague Supana Ghosh-Jarrath, who's on this call, was incredibly important in terms of getting the toolbox completed, and she was I would say my partner in crime on this toolbox. So in terms of the aims of the toolbox, it was first to develop a perception-based or a lived experience food environment survey instrument for low and middle income countries. So we were starting this survey instrument from scratch, and we did a Delphi survey and then also cognitive testing before doing the pilot testing of that survey instrument. We also modified existing objective or external food environment tools for low and middle income countries. And so this consisted of compiling existing instruments, a lot of which were designed for high income countries, and then modifying them to make them more relevant to the context that we all work in. And then we did workshops in both India and Cambodia with experts in food environments, and then we refined the tools before we pilot tested them, and then continued to refine them before developing final food environment toolbox protocols. And this process was incredibly iterative. We have like probably hundreds of versions of each of the tools. We were constantly changing them, and including when we were doing the pilot testing, particularly in India, which was the first country we pilot tested in. And we pilot tested in rural, peri-urban, urban, high and low income. And we just made so many changes based on what worked and what didn't. And some of the questions that worked in, say, India didn't necessarily work well in Cambodia and vice versa. So there's a lot of modifications that were happening over the course of the refinement of the tools. So in terms of the toolbox, we aim to be able to measure different food environment types, as I mentioned. So you have the food environment types on the left-hand side here of this table, and then also across food environment dimensions. So the idea isn't that every tool measures every food environment type or every food environment dimension, but really that with the combination of the different tools, that you're able to assess these different food environment types and dimensions. In terms of the toolbox itself, this is just an overview of what's included in it. So at the individual or household level, we have the food environment perception survey. So that's that lived experience, so how people interact with their food environments. At the vendor level, we have something called the in-depth vendor assessment, which includes questions related to what foods are available and promotion, but also vendor hygiene, and a little bit on food storage, food labeling, and also use of plastics, which we know is something that's of relevance to the ANH Academy folks as well. So trying to capture the extent to which plastics are being used by vendors. In terms of market mapping, we have a series of tools that can be used together to assess markets in terms of the availability of foods, but also promotion. And then at the community level, we have the cost of a healthy diet data collection protocol. So this is based on the food prices for nutrition work, and which is often done at the country level. And so we created a data collection protocol to enable people to collect their own food price data to calculate the cost of a healthy diet. We also have participatory mapping, which is a really great sort of qualitative approach to doing a focus group where you have the community actually map their food environments, and that really helps in terms of identifying where people are getting their foods from, what specific foods they're getting from those spaces, and then also how you might use the other tools in the toolbox in a really effective way by trying to use that to guide your approach to data collection. We also have the seasonal calendar of availability, and then a community food environment mapping set of tools that includes a food outlet census, roadside promotions, and then also mobile vendor assessments, since we know that in many places, the mobile vendors are really important. I'm going to skip over the food groups. I will just say that these are the food groups that we've used in the tools, but people can make changes to the tools to use the food groups that work best for them. This was also something that was incredibly contentious, even within our research group. And it was very hard to come up with a list of the groups that everyone was on board with. So this is something that's often very tricky. So in terms of the food environment toolbox, it includes, there's a website, which I'm going to show you just very briefly, but it provides an introduction to the toolbox. It provides cover pages for each of the tools to give you a sense of why you might use the specific tool, how you sample, what you get out of it, that type of thing. Then it includes the tool itself, an instructions manual that can be used to help train enumerators. There's a programming file. So for anyone who is collecting data electronically with tablets, we have the Kobo programming files included on the website. And you can make changes to those, or you can use them with other platforms if you use ODK, for example, or other platforms to collect your data. We also have short videos that provide an overview of the tools as well as what the tablet looks like when you're going through and collecting the data, just to give you a sense. Because sometimes when you see things in a paper form, it's not entirely clear how it will look like when you're actually collecting the data because of skip patterns. And that's especially true for the Food Environment Perception Survey, which when you look at it in paper form, it looks like it's going to take 5 hours for someone to complete it, but really it's not that bad. So, and then lastly, we have data analysis instructions and protocols. And this is something that also we're continuing to work on and to refine. So in terms of how to use the toolbox, we have a decision tree that's included on the website, and you can decide what you need for in terms of your own research questions or the information that you need to inform maybe your programming. And then you can follow this decision tree to decide which tools to use. So there are ways to access the website. So the link is here in this QR code, but there's also a link to the paper that describes the toolbox. But I am going to just quickly share my screen just to show you, orient you to the website, if all goes well. All right, so hopefully you can see the website. I'm actually going to just change my desktop because I changed to my desktop because I realized when I open up another tab, you're not going to be able to see it. So basically, you have this is the toolbox. You have an overview of the toolbox here. If you click on it, you can just see a quick video, and then you have the different tools. So if you click on any of the different tools, you'll get an overview of the tool, a short video explaining it, and then the cover page, the actual tool, the instructions, and then there's an frequently asked questions FAQ for each of the tools, which I just noticed a little typo there. So that's just to quickly orient you to the website for the toolbox, but it's open for anyone to use it however they see fit. And also we're open to feedback and to questions. So if anyone has questions about how to incorporate it in their own work, please feel free to reach out. So at this point, I'm going to toss it over to Amy and Quinn, and they're going to talk about the UFED tool.
So just building on kind of what Shauna has been sharing, the UFED tool is the Urban Food Environments and Diets. So the original intention of this was to create a tool, and we've kind of gone through a lot of different processes to get to where we are today. As Shauna was saying, it's very much an iterative process to develop a tool, so quite different sometimes than the research process you might be used to. And this work was funded by the Resilient Cities Initiative, Food Frontiers and Security under the CG Trust Fund. So we appreciate that support. We also worked with a great group of collaborators under our team leader, Deanna, and we had a group of great developer, graphic designer, and consultant, and a lot of feedback from our colleagues, which has been invaluable. And we're actually continuing to refine the tool. So we'll be sharing the link to the tool that folks can test out, and you can also send us some feedback. It hasn't yet been launched publicly on the IFPRI website, but it will be very soon. We wanted to take in some of the comments that we may receive here as well. So kind of the motivation behind UFED was that there really is interest from donors, implementers, and governments to better understand diet nutrition challenges, specifically in urban and peri-urban areas. And at the same time, as Shauna was sharing, there's a lot of ongoing work to develop, test, and validate food environment assessment methods. There are a lot of different tools out there, and we were finding that basically there was a lack of consolidated guidance on how can we think about linking diet assessment and food environment assessment methods, tools, and indicators, and also specifically for urban environments. So it kind of brought us this thought process and discussion brought us to this problem statement, which is kind of what combination of assessments can best provide a clear picture of the diet, nutrition, and food environment situations in urban and peri-urban settings for consumers in those settings. And we know this is really important because urbanization is very quickly changing food systems and diets in low and middle income countries. I'm sure all of you are aware, whether you're based there or not, the rising double burden in these contexts. We also find that there are some evidence gaps and kind of assumptions in terms of these traditional urban and rural dichotomies that are simplifying the differences and maybe don't look as closely as the linkages in the food systems between kind of this continuum between rural and urban areas, which is not so clearly delineated as it may sometimes appear in analyses. And we know that peri-urban areas and small cities are often underrepresented in the research, but really they're home to a large portion of the population. So they're very important. And there are very unique characteristics of doing data collection and doing research or monitoring in urban and peri-urban settings that may have to do with logistics or just kind of the setup of the density and complexity of urban and peri-urban food environments. We also know that there are a lot of different tools. We're limited by time, and now even more so than before, we're limited by money. So this is a challenge. We, have this whole host of options, and how do we know how to make the kind of the most appropriate choices, right? Because sometimes there are tools that may be more complex than others. They may be more detailed, but they're not always fit for purpose because we really want to, with this tool, serve the user. So we're not going to tell everyone use the most complex and detailed tool. We're going to say, based on your needs, what would we recommend to be the appropriate set of tools for you? We also work to build linkages between kind of the work that Shauna's been doing and others have been doing. And we really found that there are a lot of developed and adapted tools already out there. The Food Environment Toolbox, as Shauna just introduced, Inform Us, and really there wasn't a need to create a whole new separate inventory or a new tool, but rather we needed to think through what are those specific kind of how can we take the tools that we have, provide guidance, and also show how to approach this in urban areas. So we worked on strengthening guidance, at least on the food environment side, on a smaller set of indicators, including linking to research that has done a good job in linking these things and concepts. So providing resources for the user who is accessing the tool. And to clarify here, UFED focuses on built food environments, so it's not focusing on the perception-based or qualitative tools. That's something we may incorporate moving forward if we have the ability to do so. And again, this has been kind of a lot of iterative work to strengthen the linkages between UFED, FET, and other food environment resources and across the different dimensions of food environments. So to explain how we set up the tool, essentially you go to a web portal and there are decision trees. And so just to put your mind at rest, we are going to take you through an example. Quinn's going to take you through, because really with the tool, it's kind of hard to talk through something until you test it out. So we have this web portal. There are a series of questions that the user is guided through. The user can choose to only answer the questions on diet assessment or on food environments, or can do both. We've kind of set it up to encourage users to use both, to think through the linkages and the conceptual connections between the two. That's kind of where we're trying to lead folks. And it will take you through what your needs are, kind of your resource constraints, and then based on your responses, you'll be given a set of recommendations, both for on the diet assessment side and food environments, and also specific urban considerations in addition. And those are pulling from an inventory that's on the site. So you can also access that inventory separately from the decision tree if you just want to go straight there and download them as PDFs. Those are also available in terms of providing information to everyone. So those packages, they're really what give you the information and other resources. So here's kind of what the site looked like. Quinn is going to take you through an example, but essentially you enter into the tool, and then there's also an inventory and information about the tool as well you can access. And inside those guidance packages, as you go through this decision tree, you'll be given tool and indicator recommendations based on your decisions. There will be pros and cons of the tools and indicators that are recommended, implementation advice for urban areas, alternative data sources. So if you really are constrained and and want to look into perhaps sources of secondary data, we also provide that. But again, we have kind of a table set up to show the pros and cons, because obviously there are constraints in using secondary data and what's available. And also providing example studies, like I said, so those are all studies that are, in urban LMIC settings that are attempting to link diets and food environments and that are using these tools that we're sharing. And then as resources, references, and links for the user. And most of these are hyperlinks, so you can easily link through to where you're going. And I'm going to turn it over to Quinn, who's going to take you through an example inside the tool. And like I said, we'll be sharing that link at the end of the webinar. Thanks. You want to go ahead, Quinn?
Yep, sure. I'm just pulling up the site. Can everybody see this? Yeah, okay, great. Yeah, so this is just the homepage that Amy showed during her presentation. This is where you'll land when you come to the site. It's just giving some background information about UFED, what's going to happen when you go through the questions and kind of what you'll get out of it down here. So I'll just jump right in. As Amy mentioned, you have the option of doing, the dietary assessment portion of UFED or the food environment assessment, and we really encourage people to do both of them. I think it works best if you start with the dietary assessment. So we'll go ahead with that. You just click start here, and it starts to lead you through a series of questions. The way that we kind of designed this was, factoring in certain user profiles. So with this example, I was thinking we could kind of put ourselves in the position of an NGO that's trying to do kind of a rapid assessment, and uh, the questions that are in a specific order, and they're kind of meant to both filter out like what's the best tool for us to recommend to people, but also give the users a chance to sort of fix in their mind certain design details that will help them really navigate the guidance that we give and make sure that they focus on the most relevant parts. And our colleague Morad Morsi helped us a lot with this series of questions as well. So I'll start. Assuming we're kind of an NGO, let's say our interest is in consumption of healthy food groups. The next question is on target audience, and maybe we're focused on adolescents, and we're worried about maybe they're not consuming enough healthy foods like fruits and vegetables. The next question is asking, do you plan to use data from food composition tables in your analysis? And this is where I think it's kind of helpful. You get on this bar additional information about like why the question is being asked. In this case, we ask about food composition tables just so we can filter out what's the level of data specificity that people will be able to get, but also, what's their level of technical expertise, and, what might be their general level of resources to carry out data analysis. So as I mentioned, if this is an NGO, maybe there's just kind of one nutrition officer there, and they really need something that's like, ready to use off the shelf, low resource. So we'll just select no here. And then we get this question, what's the level of data specificity that you need? And this is going in increasing order. So it's starting with some, just kind of dichotomous levels of specificity. Is the food group being consumed or not? Is the food item being consumed or not? Then it gets into a categorical level of specificity. And then these levels of specificity here, the higher ones, including, specific micronutrient intake quantities, we actually can't get those because, we chose that we weren't going to use the food composition tables. So you get a little explanation of why the option isn't available if you hover over it. But let's say in this case, the NGO, they want to have like a little bit of information, not just on whether food groups are being consumed, fruits and vegetables, but, is the level of consumption low, medium, or high? So we can choose that one. We then ask, are you interested in measuring long-term diet, like over the span of a month or a year? Let's say that there's not interest in that. Um, will this assessment take place within a clinical trial or a controlled environment? Again, that's, not something that the NGO would be doing in this case. And will phone interviews be used to conduct the dietary surveys? So in this case, we actually don't have the option to select yes, and that's because this level of data specificity is allowed by the GDQS app, which hasn't yet been validated for phone surveys. And some of you might be familiar with GDQS. It uses these different size boxes to try to get at those quantities, categorical quantities of consumption. So we select no there, and then we get what the recommended tool is. Sure enough, it's GDQS. And Amy kind of went through some of the sections, but I'll just scroll down this guidance for you. You just get an overview, some a basic rationale for why you might use this compared to other methods, what's the type of data. Then it dives into some specific indicators you can get from it, and it gives you guidance as well on, under which scenarios you might want to use certain indicators. And of course, users, what we intend by starting with first, what's the problem you're addressing, is that users, by this point entering into the tool will kind of already have, what's their research question or what's their assessment goal that will also help them filter through these indicators. You get pros and cons of the particular method. You get information about, validation studies. You get information about, what you might do if you have a lower level of resources or a higher level of resources to adapt the tool. You get sampling and data collection considerations, and then some possible sources of secondary data. And then, as Amy mentioned, also illustrative studies that have used the tool or indicator and related resources. So these different sections of the tools are pretty common across both the food environment and diet. And what you also can do here is get an option to download the PDF. And we also have this urban considerations section. So this is has a lot of really useful information about, specifically, doing dietary assessment and food environment assessment in urban and peri-urban areas. It starts with some key messages. And I'll kind of go way down to the bottom as well, like linking food environment and dietary assessment. We spent a lot of time on, some recommendations for, how people might be able to do that. And throughout this, we've also really tried to, drive home some of the same messages from, Shauna and her colleagues on the food environment toolbox, including, the importance of doing participatory mapping, which, while it's not a food environment tool in UFED, it is something that we really recommend people consider. And so you'll see here, it says, please complete the food environment section, so you don't have a PDF there yet. And that's what we can get to here. There's a separate set of questions for the food environment. It first asks you, what target, what type of food environment does your target population engage with? Let's say we're thinking about the adolescents still. Maybe we're thinking about school environments and school food environments in particular. You know, what types of food would you like to assess in the food environment? You know, this is because not all the tools and indicators are able to kind of measure both, you know, access to healthy and unhealthy foods, like cost of diet, for example, doesn't really include unhealthy foods. So let's say we're still just focusing on the healthy foods here, and we want to look at maybe accessibility of fruits and vegetables, thinking about the school food environment. Maybe we're interested in things like, are there vendors that are selling fruits and vegetables around schools? So we pick that. And you know, this then includes guidance on community and market mapping, you know, which we've tried to adapt as much as we can from the food environment toolbox, and included references to that. And again, the sections are very similar to what I showed. You get what's the type of data, what are some indicators. You see some specific guidance on, you know, how you might use these indicators in a school context. And again, uh, there's some kind of specific, there's some sections that are particular to the tools, but overall they're the same. Still pros and cons, and tool and indicator validation. Obviously, it's a little different for the food environment than it is for the diet in most cases, since you know what we're doing with the food environment oftentimes is still looking at feasibility of collecting the data, and maybe sometimes reliability studies. It includes the lower and higher resource adaptations, and some possible secondary data sources, then illustrative papers again. So that's just the general layout of how the site works. Again, you can download the results. Now we do see that you get the food environment PDF, and you can also download them combined. This link here goes to the same you know, the same results page. And the last thing I kind of wanted to show was the inventory. You know, if you're not interested at all in going through the questions, you can just access the specific tools here to see the guidance that we have available. For the food environment, they're not perfectly aligned to the food environment toolbox, and that's because we wanted this to be food environment dimension specific. So we kind of have this food and beverage promotion tool, but in the actual tool in the food environment toolbox, that's integrated with the community and market mapping and the in-depth assessment. So, you know, we try to explain that within the guidance as well. And lastly, there's kind of this, you know, glossary of helpful terms, which, you know, all of these things, the glossary as well as all of the pathways, you know, we're really happy to get feedback from everybody about those. And I think, you know, we're really happy to be presenting this in ANH. As Sunita mentioned, it's, you know, a space for learning. So we're, you know, really eager to kind of learn together and get you guys' feedback. So thanks so much. I'll stop sharing and hand it over to Shauna.
Great, thanks, Quinn. That was great to get a first look at the UFED tool. I will just flag that there's a couple questions specific to UFED in the Q&A. So I don't know if you want to answer it in real time or if you just want to type your answers in, but up to you.
Maybe to not hold up the panel, I can try to respond to them like in the comments.
Okay, cool. Yeah. Sounds good. All right, so I am very excited and feel very grateful to have such a wonderful group of people here on the panel. So I'll start by introducing the panelists and then ask them to share some of their experiences related to incorporating food environment and dietary assessment tools and metrics into their own work. And then we'll open it up for questions from the audience. So please do use the Q&A tab and put your questions in there. And so we'll make sure that we leave enough time for those questions to be answered. So our first panelist is Giacomo Zanello, who is a professor of food economics and health at the University of Reading, where he also serves as the head of the Department of Agri-Food Economics and Marketing. His research lies at the intersection of food systems, nutrition, and development, with a particular focus on LMICs. Supana Ghosh-Jareth is program head of nutrition at the George Institute for Global Health in India. She has 29 years of experience as a clinical, academic, and research nutritionist. She's actively engaged in research projects on food systems, their drivers, food security, food and nutrition policy, and many other things. I've been working with Supana since I was a beginning PhD student, and she's just amazing. And I'm very grateful to continue to be working with her today. Then we have Winnie Bell, who has over 15 years of experience in international nutrition research. She focuses on dietary assessment, food preferences and values, and sustainable and equitable food systems. Winnie is Senior Technical Advisor at Intake, Center for Dietary Assessment at FHI 360, where her portfolio of work includes the development and operationalization of metrics to measure the nutritional quality of school meals and menus, provision of technical assistance to countries conducting national quantitative 24-hour dietary recalls, and many other things. And last but certainly not least, someone that everyone I think is very familiar with, Amos Lar, who is a professor of public health nutrition at the University of Ghana in Accra. His research explores the connection between food environments and diet-related non-communicable diseases, as well as how social forces, commercial influences, and structural violence affect the realization of health. He is a very active researcher and has done a ton of work related to how some of this food environment information that we're collecting with these tools can really feed directly into policy and making really important policy changes in Ghana. So with that, I'll get started. And I think I'll start by asking a question for the whole panel, and then I have some specific questions for each of you as well. So the first question is, what drives or hinders the adoption of food environment tools in the countries or regions you work? And I'll let whoever wants to start open up. Unless people are shy, and then I'll just call them out. I will, yeah, go ahead, Supana. I was going to call you out, so
all right.
It
worked. All right. So if you are asking me what drives, because I think we work in very diverse food environments, and the diversity is in terms of the different kinds of food environment people have access to, be it urban, be it rural, because even peri-urbans have access to some of the homegrown foods and natural food environment, as we may say. And that kind of makes it, the tools that are developed in the high income group context are very specific. And I think they are constrained by the scope of the tool in accessing the different kinds of food environment. And I'm speaking in terms of the food environment assessment tools, not the dietary assessment tools. But for that matter, even if I look at GDQS and I see that it is validated in developing countries and all, but if you go to a specific place where I just give an example of, say, milk, and they are saying that high fat milk, and they're saying that it doesn't, moderate consumption and stuffs like that. But the context is very different. So adapting the tools from high income country to low income, no middle income country, which are transitioning so quickly, it is very difficult to actually accommodate both the ends of the spectrum in the same tool. And that is where the challenge comes, and that is when we have sort of decided to adapt the tool and work in diverse food environments. And no wonder the urban food environment tool itself is quite different from the rural food environment tools that we have piloted for the food environment assessment, because urban is really transitioning, modernizing, has access to all kinds of multinational companies, bombarded with food products from all across the globe. So you would need a tool which is very close to a high income group tool, but has some nuances of the low middle income country. While I go to the tribal community that I work with, and I see people are still having a good percentage of their dietary intake from the forest produce, from the kitchen garden that they have in their backyard, the foods they are still exchanging with their neighbors, and the kind of public food procurement programs that we have in all our countries, because we have food security issues and at the same time. So we have excess of both. So we have access to, to cut the long story short, it is basically the sheer diversity of the low middle income country is something which kind of drive are the hindrances which makes us a little challenged with using simply adapted tools from high-income countries, and there is a lot of adaptation that is needed to use these tools in our context. I'll stop here.
Mm-hmm. Thanks, Suparna. Does anyone from the panel have anything to add to that question?
Yes, Amos here. Yeah, I agree totally with all the all of the suggestions she has given as to what is it that SAFE challenges. Just to add 2 or 3 more things. Sometimes even just being aware that such tools exist and to then use is one of the challenges. And so if you are not aware that tools like that exist, then you wouldn't have the opportunity in the first place, to trial them. There are times when people become aware, but then they are not really interested. So interest is the second thing. You are aware, but you have to be interested to then try them. And it's like a cascade, right? You are aware, you are interested, you don't have the capacity, to deploy the tool as developed. And then people's capacity get built, they want to use them, but then the broader political economy, challenges also then come in. The last thing has to do with what she indicated earlier, right? The fit for purposeness of the tool. So if a tool is developed in one setting and that exists, is being used, and you are interested to use in your setting, and it's not really fit for purpose, that could also, impact non-use of that tool, just building on what has already been said. Thank you.
Great, thanks, Amos. Winnie, I wondered if you might want to answer this question more related to dietary assessments and kind of what drives or hinders the adoption of, high quality dietary assessments in LMICs.
Yeah, sure, happily. And I also just want to, absolutely agree with what both Suparna and Amos said. And I think that a lot of, some of this also applies when it comes to thinking about dietary assessment or measuring diet quality in country, right? So it's really, what's the level of awareness? I think when it comes to dietary assessment and diet quality, there's been a lot of advocacy and efforts made in the last decade, a little bit more than that, to really raise awareness and sensitivity around the importance of measuring diets. And so we're seeing that happening now. But just, thinking across to your original question, Shauna, and why, the extent to which the adoption and measurement of food environments is happening or not, I think we're really in the early stages of kind of sensitizing people to what that means, what is this new terminology, and then how and why is it actually important, right? So we know the diets are kind of one of the endpoints of the food environment, but now we're sort of backing up and thinking more about why are people making the choices that they are and what are the environments they're existing in. So yeah, just as far as, to get to the question that you're posing now directly to me in terms of measuring diets in these contexts, there's, a lot of it dovetails with what Amos pointed out. There's just a lot of constraints, right? And a lot of competing interests and motivations and limited resources and time. It's the same everywhere. So I think we have seen shifts. I think, at Intake, we work really closely with governments, and a lot of it is about identifying champions or champions coming to us with their motivations and interests, and then building relationships over time. And I think those things are constant across all areas of work that we do, right? So the same holds true for dietary assessment related work.
Great, thanks. Giacomo, you recently completed an Amana-funded project that was incorporating how consumers interact with food environments. And I'm wondering if you can share a little bit about that. I did see there was a comment in the Q&A about people's perceptions of their food environment and the importance of capturing that. And I think the work that you did as part of that project was really interesting and innovative. So it'd be great if you could share that, because as Amos said, you need to know the tools exist, and we don't always know what's all out there in terms of different approaches we can take to our work.
Yeah, thank you, Shauna, and yeah, really appreciate the opportunity. Yeah, the focus of our work was mainly to understand not just the food environment, but the behavior of people, how they navigate in the food environment. So what we did is to develop a much rougher and simplified version of what Shauna described. So something that tried to capture the different sources of consumption of food, But the difference is that what we do is we try to compile within communities the universe of different outlets where the individuals procure their food. And knowing individual behavior, we are able to address to what extent they utilize the food environment, the universe of food environment. So we assume that everyone could potentially use all the food outlets that are available, but inevitably they don't. They don't for many different reasons. And we did this research in Thailand and Laos, and what we see is we developed this methodology, but also we try to look at what's the relationship between dietary intakes and the utilization of the external food environment. And for example, what we see in Thailand and Laos are very different behavior. People that are more engaged with the external food environment, so they rely more on buying food. In Thailand, they tend to eat less healthy food, whether in Thailand, whether in Laos, they tend to eat more unhealthy food. So if without this kind of tools and this kind of granularity, we observe a lower quality of diet, but we don't know exactly the mechanism. So this is a little bit an insight that it can give us knowing the behavior of people. So we are I think it's important to recognize that the food environment sometimes we look at it in a static way, where there is a very dynamic environment. And that's what we try to do with our research.
Great, thanks. And I think that is, it brings like these different pieces together to then help inform interventions or policies. Suparna, you have done a ton of work on tool development. So obviously I mentioned that you worked on the food environment toolbox with me, but also you were integral in the UPF screener. You've adapted the TAPE tool for agroecology performance evaluation for your own work. And I'm wondering if you can talk a little bit about kind of building off of what Giacomo said in terms of like kind of bringing these pieces together. But I'm wondering if you can talk a bit about how you've incorporated these tools in your own food systems work, where you're collecting data across the food system, and what some of the strengths and limitations of that is.
Okay, so yeah, as we all know, food systems work in LMIC countries, low middle income countries, is still at its infancy. It is evolving, and a lot of research is informed by what has happened in the high income countries. But while working with the indigenous population of India, I just realized that utilizing these tools as they are and just kind of just adapting them might not work. And that is when we looked at some of the tools which are adapted for African countries, for example, and understanding the context being similar. So understanding the context of how we are working in different contexts and how the tool needs to be adapted to the context is very crucial. So I'll just give you an example of the UPF tool that we adapted. And it was developed in a Latin American country, and then we could have expected that minimal adaptation was required. But all the food systems in the LMICs are transitioning, and while these systems are transitioning, a lot of traditional practices are being adapted into market foods. So not the practices, but traditional recipes. So starting the entire process again became important, and bringing different stakeholders. So rather than just working as a research group and adapting the tool and just setting up the context, rather than doing that, we went on a very divergent kind of an approach, wherein we first had consultations with several experts in different domains, starting from policymakers to the industry to the nutritionists. So it is such a cross-cutting field that we had to have food scientists on board also to understand their perspective of how market is evolving, how food items are, how they are catering to the consumer demand of having traditional foods as ultra processed foods, which are convenient and coming to the food plate. So to do that, it was a full 2 years exercise wherein we had to get information and inputs from the entire context, from production of these foods to the food environment and how consumer perception is changing. So all these put together helped us to adapt the UPF tool. And if you see the adapted tool, it is totally catering to Indian community and the Indian food policies. For example, when Senegal adapted the tool, they had all the names and brands being written on the tools pages and the pictures were all there. But for us, there was a huge pushback if we put the names of the companies on those tools and on the name, on the foods, and just sort of give the names of specific companies. So we had to adapt the tool, the presentation, the graphic of the tool had to be changed as well. Now, coming to my Indian food and the indigenous food study that we have done, and why did we adapt tape tool? The purpose of the tape tool was little different. It was towards agroecological performance. And what we wanted to assess was the agroecology and how things are so different in communities who are still into natural farming, subsistence farming, and things. So despite the fact that it was used in African countries, still a huge amount of adaptation had to be done, just understanding the farming system of our country. So, agricultural people came on board, and definitely it was not our expertise, domain expertise as public health nutritionists or food systems researchers, but, we took the tool to the agricultural experts and they sort of adapted it, and each question needed to be changed based on Indian measures of production, Indian measures of cultivation, irrigation, and everything. So the point is that anything that we are trying to adapt, and as I said, food systems research is so cross-sectoral that we have to have a combined cross-sectoral effort, a complete adaptation with contextualization, and then based on the feedback of those multi-sectoral people, something which develops is totally different. But while developing these tools, we also consider that these can be put to use for global purposes. So developing the tool is important, but side by side for the food environment toolbox, like we have given specific instructions of customization and adaptation, that is also equally important. I'll stop here.
Thanks, Suparna. And I think that's very true. Like, I think that we do have to adapt the tools to the context we're working in. And I'm going to ask you a question, Amos, but I'm wondering, I think because you were using the Informis tools, I would imagine that that required some adaptations as well to be able to use them in the Ghana context. And so I'm wondering if you could just talk a little bit about that first, and then I'll ask you the real question I wanted to ask you.
Okay, sure, yes. And yeah, you were very right in your introductory framing presentation when you invoked the complementarities, right, of all these different approaches. And that is, yeah, rightly so. If you take the Informis approaches, for example, there are many models. One of the popular models is the Public Sector Healthy Food Environment, Policy Index, usually referred to as FoodEpi. And so when we tried this in Africa, so in 2016, 2017, South Africa tried it, Ghana in 2017, Kenya in 2017. Since then, over 10 countries have tried that. When we implemented it in Ghana and then in Kenya, we had to do some modifications or adaptations. And so, for example, those who know the history, these were developed to address, NCDs, obesity. And yet in our context, although NCDs, obesity are major problems, we also still have undernutrition to deal with. And so what the stakeholders we engaged recommended was that it would be good to have some of the indicators also address undernutrition. And so in Ghana and Kenya, we introduced 2 indicators. Following that, other food epi work in Senegal, in Tanzania, and in Uganda have actually now introduce what we refer to as like a double duty or double bedding indicators, where you have a suite of indicators addressing undernutrition, which is a big problem in Africa. So those modifications are done and they are necessary.
Great, thanks. Okay, so what I wanted to really ask you was that at the end of the day, the reason why we're collecting food environment data, and I think also to a certain extent dietary data, is so that we can inform the development of interventions or policies or programs. And you have been doing a ton of work on the food environment policy space. And I'm wondering if you can talk a little bit about some of the biggest challenges, but also the opportunities in collecting and using food environment data, including the data that you collected using Informis to actually get policy action.
Yes, thank you. So yes, there a number of challenges, and as we have worked as part of the Africa Food Environment Research Network, some of the challenges that I share here also resonate with other countries in the sub-region. And so the biggest challenge has always been, either the absence of the data that is needed, or the data exists, but it is.
Oh no. On my end, oh, Amos, you froze for a second. You left us hanging right when you were about to tell us the greatest challenge.
Oh, sorry. So I think it's my internet is weak. So I was just saying that some of the challenges that I'm going to talk to you about are based on our experiences doing work in Ghana, but because of our work on the Africa Food Environment Research Network, other countries in the region have also reported similar challenges. And so one of the biggest challenges is the absence of the data that is needed. Or the data exists but limited, and therefore, the data poverty question. And so in Ghana, we experience that data poverty, but we also experience policy inertia. You have the data, but that data is not being used by advocates to engage policymakers for them to take action. So that is a second challenge. But when we started generating the data in Ghana, the third challenge we realized was that it's not just about data. The data got to be generated, but that data ought to be curated in a way that those who need to use the data can use the data. And so as academics, we're professors working in this, but we had to become students and learn how to curate this data in such a way that policymakers can use the data we generated. Curate them in such a way that civil society actors can use the data you've generated. And so those challenges need to be addressed. I've already talked about the political economy related data, challenges where you have actors with vested interests, you are generating data, but they are also generating alternative counter data, and that has to be addressed. Otherwise, if you generate your data and you think your data is gospel truth, I'm sorry, you'll be disappointed because they are counter data generated by actors with vested interests. And so industry interference and others, we always have to address them. Some of the lessons that we have learned in Ghana is that you don't wait for counter arguments to be put out there for you to address. So in other words, prevent those fires other than putting off the fires. And so you have to learn to preemptively address those oppositional argument for things like this. And last but not least is money. Some of the data that we need are commercial like data, for example, data from Euromonitor and other, and it's just so expensive. And so those are challenges that we encounter when we are interested in impacting policies in this space.
Yeah, and I feel like the financial constraints is something I think that is obviously very up close and personal for all of us, I think, at this point, and definitely a real challenge. Winnie, your work has focused on developing tools and methods to enable less labor-intensive dietary data collection. I'm wondering which innovations you see to be most promising for scaling up diet quality monitoring, given that there's also this context of, being resource constrained as well.
Yeah, absolutely. It's a great question. And this is really central to a lot of the work that Intake has set out to do over the past number of years. I mean, and it's such a balance, I think, especially as Suparna noted, with any of these tools, right? Balancing the sort of context specificity with having global comparability and ease of use, of course, as well. So, I think Quinn, during his nice demo, highlighted the GDQS, the Global Diet Quality Score. Of course, being on a team of people that helped develop that original tool, I see a lot of value in that tool, in part because it is it's been validated globally. It's been validated across age groups. It is not restrictive in terms of specifying certain diets or certain foods. So it draws from a global database of over 7,000 food items at this point. So I think, tools like that are really designed to be used in any context with limited adaptation needed are really the direction that I think the world is moving. We are, I'll just mention in terms of innovations, and I wrote this in a chat in response to a question from somebody named Mayreen, also working on a tool called Intake for Earth, which is designed to measure the environmental impacts of diets alongside the quality of the diet itself. So I think, of course, with technologies and with all of these like rich databases of foods that are now existing, I think we'll see a lot more of these types of opportunities moving forward in the dietary assessment space, at least. Of course, there's still, I saw a question from Gabby about, what about self-administered tools that can be easily utilized by adolescent or school age populations? I think we're still looking for some, we have tools for sure, and image-based tools are forthcoming, but tend to be used so far in smaller populations. So when I'm really, the work we do is really at the national level for the most part. So thinking about what's scalable and can be adapted and used across countries is kind of gets to another level, I think, beyond smaller studies. So I'll leave it there for now. Thanks.
Great, thank you. Giacomo, do you think, kind of building on that, do you think that there's opportunities to integrate food environment data in national household surveys or those types of kind of surveys that are collecting a lot of data?
Yeah, no, Shona, and this leads very well from what Winnie said. How can we scale what we are producing? That I think is what we develop. That I think is the big next question for us. I do think, and I'm talking for myself, that sometime we want to capture something very well, and we ended up creating something very complex, something that actually the general use meet the constraints that Amos was sharing very clearly in terms of cost, in terms of time and expertise. So I think yes, there is definitely an opportunity, and we have seen in the past how tools that have been developed have been integrated in larger national surveys. I think is a question to what extent we can make them rigorous enough that they can be used in a survey with many other questions, and it needs to be in a 5 minutes kind of 5-8 minutes kind of module. And I think that's the challenge for us as a community. Try to focus on something good enough, but aiming for the richness that we can get from a much larger scale data collection rather than a more case study approach of knowing a lot about a very small part of the population.
Great, I think that's so true. There's always this balance of like, is it like good enough versus like ideally what we really would love to capture. And I think sometimes we get caught up in that, and then all of a sudden you have a survey that takes 5 hours for someone to complete. So reaching that balance is really important. All right, so I want to open it up for questions from the audience now. I think Amy and Quinn are monitoring the chat, but also feel free to unmute yourself and ask a question to the panelists. If you have questions for Quinn and Amy as well about the UFED tool, you're more than welcome to ask those as well.
So a lot of the questions we got through the chat, Shauna, we've already answered, and Sunita answered one too. Winnie had caught the one from Gabby. I'm not sure if any of the other panelists have any thoughts on, this, tools that could be self-administered, that have been validated. So the panelists are welcome to chime in on that if they have anything else to say. I would also, one that I responded to that I wonder if maybe Shauna might have some questions about, or, the panelists as well, was just the question of validity for food environment tools and indicators. Shauna, I know you did different types of testing for the food environment toolkit, so I have some thoughts, but maybe it's good to hear your experience too with Suparna.
Great. Yeah, I can start there. So with the toolbox, we haven't fully validated the tools. They've been more assessed in terms of feasibility. We did do some face validity assessments with experts who are doing food environment research, but we have at this point only really implemented them to assess feasibility. We did check things like how long they took to do the tools, that type of thing. And we're still working on indicators as well, because I think that was one of the challenges that we have found with the toolbox, is like trying to understand, like, once you collect these data, there's a lot of data, and what is the best way to kind of tell the story that you're hoping to tell, and what indicators are most relevant. And I think one of the things that has been particularly challenging is also related to the food groups question, but just the categorizing foods as healthy or unhealthy, and that, because I think a lot of indicators are based on that, but it's really hard to reach consensus, I think, sometimes in terms of what is considered healthy and unhealthy. And I think what comes to mind is like prepared foods often that are sold by street vendors, and they're potentially some pretty healthy, but then, they might not be considered because of the oil they're using or other factors. And so I think sometimes it gets a little bit tricky, but it's definitely a space that we're continuing to want to work in, and obviously trying to identify some funding so that we can continue that work. I don't know, Suparna, if there's anything you want to add about that.
No, I just go with what you've already said, and we have discussed at length that yes, we need to validate these tools, but we are also saying that these can be taken up as customized modules. So we have several modules in the FEPS tool, the Food Environment Perception-Based tool. So, we have 6 sections, and you just pick up 3 sections and then have a specific scoring system, or how do we go about that, and then validate it against a dietary assessment. So that is what is the plan, and we would love to do it, but we want to do it in a very innovative manner so that each section can be a module which can be picked up based on a research question which a group is trying to address. And just one more point I wanted to add for our tools is that the adaptation was also difficult because the perception about food promotion, and you just take that same module and bring it to a rural environment where the food promotion is so different. It's word of mouth, jingles, local traditional songs. How do you capture those? It's not counting the billboards which are across on the street. So it is a complete adaptation. And then, since we have adapted to that extent, validation becomes critical. But how do we do it is the food for thought for our entire group to think about. But we have some ideas which we are kind of trying to do as our follow-up study. Over.
Sunita, was there something that you wanted to add?
Yeah, thank you. Sorry, I don't mean to take time from other participants, but on that validation part, I was wondering what is the best way to validate some of these because we like to say it's been validated globally and go on and use it because it's such a headache to do other things. But also sometimes it doesn't work in the local context as well that we see. Not just jingles, but when you see promotion for healthy foods, what does it even mean in terms of a rural context? Is entirely like for fruits. What does promotion for that mean where none really exists? That sort of thing. So, what does validation look like in your experience? Is the dietary assessment the right and a fair way to actually a bar to hold a food environment tool or a metric to? If not, then what would it look like? That's one question I have. And I'm just second one is anything that enters into say a big survey is really descriptive, right? We can describe various dimensions of the food environments, which are important, of course, like many of these. But do any of these food environment metrics or tools help us for evaluative purposes? How have the actions changed or in the use of trials and so on? And my final question, you don't have to answer all this, we can regroup again, is more of a controversial one in terms of where do we go next? Do we have enough tools? And do we need more? And why do we need more and where? If not, what should the next step look like? Is it a watershed moment where all of us need to come together and think through what all this means? And of course, UFED tool is really important in helping us navigate that. But in terms of, do we need more tools? Why do we need it for? What should the future of this look like, metric and method development? I'm just wondering what you think about. I have similar thoughts about actually women's empowerment as well, but I'll leave that one out here. Anything you want to take, otherwise we can regroup again. Yeah.
Thank you. Actually, that was going to be what your last question was going to be the last question I had to the panelists. So I think that's perfect. I'll just say very quickly on the validation, I actually don't have a good sense of what it looks like. And that's part of the problem is that I think it's kind of hard to envision, like maybe it's with diet, like connecting or relating it with dietary data, but then I don't know if that's actually the best way. And so we're definitely, for the Food Environment Toolbox, incorporating some of the tools in an existing project where we're also collecting dietary data. So we might have some possibilities to explore that. But I don't think that there's like this is the way you have to do it. But I think I do want to, unless there's anyone who wants to add on the validation. Yep.
I wanted to add one thing, and I don't have an answer, just kind of more questions, but just an observation. When Amy and I were doing the UFED and we had the dietary assessments and the food environment assessments, it's like very clear for diet, that you have kind of many ways to measure similar things. And, you want usual intake, you could try to do a food frequency questionnaire, you could try to do 24-hour recalls. You have kind of gold standards as well that you can measure against, like the observed weighed food records. And so I feel like sometimes when people are talking about validity studies for food environment tools and indicators, they're expecting those same types of validity studies. And I'm not sure if like that's where where we are right now. Maybe it's still starting with like the content validity. And I think, what Shauna and Sunita are talking about as well as, some predictive validity, looking at, what is actually related to food purchases and diet outcomes.
Yes, I agree completely. All right, so in the interest of time, I'll just open up that last question that Sunita posed about like, where are we at? Do we need to be developing new tools? If so, where are the gaps? Where do you see this field kind of going moving forward? And we have like, I don't know, 3 minutes or so. So whoever wants to answer first, yeah.
I can, Amos, go for it.
Yes, not a direct, answer to the question, but I think that there are a lot of tools out there, right? And for me, whilst there's a need for new tools to be developed, I think we could push the needle in the direction that we wanted to go if we make use of the existing tools, maximally. And so whether it's, women empowerment, as Sunita, you were indicating, it is possible to tweak existing tools, add or remove for them to address, new research questions that existing tool cannot address. So for example, I just talked about the IFPRI's Public Sector Healthy Food Environment, Policy Index, FoodEpi. And when it was originally developed, NCDs obesity facing. When we started adopting it in African context, we introduced the double bedding, indicators. And now it is the same tool. It's not a new tool, but the tool has been, modified in such a way that it is addressing a new need. So it is okay if we have the resources to develop new tools, but I think we could make a lot of impact if existing tools are being put to good use.
Agreed. Winnie, do you want to?
Sure. It's just, underscoring the fact that it's really how are we using this data and this information for decision making, and really getting to that point. So Amos earlier had spoken about sort of the data curation and the accessibility, and how do we make it digestible to people who might not be on the front lines or in the research positions. One of the things that Intake has really grappled with, because this is a question we've come up against, like, okay, it's not just enough to provide technical assistance to governments to collect the data, but what do we do next? So in this last phase of work, we've been conducting these sort of curated dietary data use workshops, we call them, and we work directly with multiple sectors across the government. So we bring a bunch of different ministries together, multi-sectoral, and then we discuss different ways that dietary data in this case could be used. I think for food environment, it's a similar thing, right? It's really across sectors that everybody kind of needs to wrap their heads around how the information can be used and then take action. So that's the first step in our case. And then we work with those different sectors to develop different analyses, policy briefs, those types of things that can be leveraged within the government to then implement and see change go forward. So I think that just kind of fits into one piece of the puzzle, but in general, I think we need more digestible, easily accessible data visualizations, nicely packaged, better marketing, all of that. So that's the next frontier, in my opinion.
Great, thanks. Giacomo, do you want to add?
I'm just aware of the timing, so just very, very briefly, something that I mentioned a little bit earlier. I feel, and I think personally, that the next step is maybe to connect those tools to the behavior of individuals. And to me, that's very much when then open up all sort of intervention, also at behavioral level, which are a much greater set of options for policymakers. So the challenge to me and the excitement looking forward is how can we move the tools that we have, related them with the kind of behavior, how people behave, navigate this space.
Great, thank you.
Shauna, I have just 2 points, and that will be one thing is what Sunita asked, can these tools be used for evaluation of interventions? Well, yes, because the external food environment assessment tools like the community vendor assessment and stuff, and if we have a community-based intervention wherein we are working with the vendors, what they're selling, and kind of making them use natural food sources and giving them education and training, and we do a pre and post, well, we can use the external food environment tools which we have developed as a part of the food environment toolbox. And in terms of validation, I also feel that we have some perception-based tools, the lived experience tools. The findings of those can be very well correlated with the external food environment stuff, and the participatory mapping, what we find there versus what is actually available. So that kind of a validation exercise can be is something that I'm thinking of. Regarding extra amount of tools, I still feel that we need to do a real gap map kind of a stuff as a group, and understand that yes, LMICs have certain more kind of exposures which are not accounted for, or we are not sensitive towards it. And that is where I found the tape tool was useful somewhere, if that can be adapted and put into our toolbox, and we have had discussions. So yes, I think there are a lot of tools there. Now it is important, like Winnie has said, to condense them, present them, have specific indicators and go with it, but continue to keep thinking about where lies the gap and what is that which we are not able to assess using these set of tools which we have adapted. I'll stop here. Thank you.
Great. Thanks, Suparna. I think that's a great note to end the discussion on. I know we only have a couple minutes, and I need to pass it over to Quinn and Amy to close us up. But I just want to thank the panelists. That was excellent, and it was so great to hear your valuable insights on these topics. So thank you again. It's definitely a rock star panel. So I'm very, very happy to have you all here. So now I'll just pass it over to Quinn and Amy.
Great, thanks, Shauna, and thanks to all the panelists. I've been really looking forward to hear this conversation, and it was great to be a fly on the wall and also see the great questions from all of our attendees. So I'm just going to try and synthesize some of the things that I heard coming out of the panel, which did really coalesce around a couple themes. So I think what the panel was saying, and we also heard from some of our attendees as well, there's really an issue around accessibility and awareness of the existing tools. There are a lot of them, and I think that's, I know at least from the perspective of developing UFED, that's the angle that we were approaching this from as well, where once we started surveying the landscape of the tools, we said, you know what, this is really, not about developing another tool to add to this whole kind of toolbox of what's out there, but was to look at what there is and help guide people to the options and figure out what they need. And so I think Shauna's work also addresses this, and really all of these resources will be available on the ANH Academy. This is an important role that ANH Academy plays to help provide those resources to folks, not just to researchers, but really like how can we connect with other folks who are policymakers, implementers, people on the ground. Like this is not just doing research studies, but also for monitoring and very pragmatic uses. So that's, I think, like democratizing these tools and making them comprehensible and accessible will really help everyone. And so I think that's an exciting development. I think there still are obviously areas where we need to continue to adapt the tools and look at new ways of validating them, just in the perspective of how food environments and LMICs, their characteristics, just thinking through, are there ways we can come together as a community and think about how we can validate them and make sure they're appropriate, but while also identifying, are there any remaining gaps? We have a lot of tools, but maybe they're focused on specific dimensions of the food environment. There are specific dimensions where there's just so much, and others where we feel like there are some gaps. So I think, identifying if there are holes there to address those. Amos made some great points on data use. So if we're generating, we've all been in a situation where we generate a lot of data and then not all the data is used. And so I think that's kind of we want to avoid that, right? Particularly as we're in these financial constraints, that we don't really have the luxury of, collecting a ton of data and then deciding later all the things we want to do with it. So I think being very deliberate about data use and curating those is also critical in addressing the funding constraints that we are facing. And I think understanding our role as part of the political economy of all of this is important. Sometimes researchers are uncomfortable being advocates, but I think it's essential as researchers and others working in this space to advocate for our own work. I think that's something that, folks at USAID have really reflected on and saying, there are ways that, we need to advocate better for our work to the public in a way that's really accessible. And I think that is critical in this moment. That's a learning that we can do among our own community, is how to better communicate all the work that we're doing, and also any work that we're doing directly with governments or policymakers. Like that helps with that advocacy and thinking about scalability. So those are kind of my takeaways. I don't know if you want to add anything, Quinn, to what I've said.
I don't think so, Amy. I think you did an awesome job summing up the conversation. And the only thing that I would just kind of say is, reiterating that we're still, really interested in having feedback from everybody on UFED. And so you guys have the link in the chat, and we're gonna probably put it in an email address and like a feedback button at some point. So you should see that.
Great. I don't know if anyone else wants to from the panel or Sean or Sunita wants to say anything, but otherwise, we really appreciate you taking the time and to listen to the discussion.